The lessons learned is that unfortunately the voices of nurses were very silent in the backdrop or in the health sector. And the disconcerting thing is every Minister of Health that I've ever met have said that nurses are the backbone to the healthcare system, but often that's lip service, because when we were needing to do the screening, it was our nurses that were out there on the front line that were screening and swabbing. And that what they were saying in terms of access to PPE gear was being ignored. So there's this power imbalance in terms of nursing voice and presence. So what we need to do as a group of nurses is be really quite united moving forward to insist that we're at the table of the decision making, and to insist that the role of the nurse is just as professional and valued as the role of a doctor within the system. And that hasn't happened. So we were really pleased that we took a strong position to advocate, and we have to continue to take that position and to advocate to be at that table, to be the squeaky wheel, I guess, because nursing is largely overlooked. And I would hate to think it's because most of the nurses in the country are women, but it seems very much that the decision is made by people that are not female. I think when we were in this state of emergency, that the drivers, the decision makers were policy makers and law enforcement, and they were making decisions that were not inclusive. Part of that decision making was not made by doctors or nurses. And I think nursing did have a very strong presence to start with. And sometimes I must admit, I looked around to see where the doctor's voice was and if we were united. The only benefit of this is that our organisation works with other health unions, so that we knew that doctors were on the same page, but it would have been encouraging to make sure that we were both challenging the system and the inadequacy of the response from government. But it's to be a little bit catch up at times. It didn't feel to be a united, collaborative health professional front.